Welcome to Mission Oriented, a veteran crowd podcast that showcases veteran talent from both the private and public sectors. Their impact is everywhere. We are here to uncover it. Here's your host, Bob Louthan.
Welcome, everybody. This is Bob Louthan, host of the Mission Oriented podcast by Veteran Crowd. Welcome. It's good to be back. My guest today is Dave Esra. Dave and I have met by being in the same cohort with the Founder Institute. He is the founder, president, and chief executive officer of Bobi Health. He's in San Antonio, Texas.
Correct.
Enlisted in the Navy, then wound up getting religion and coming into the Army. My guest today, Dave Esra. Welcome to the program. Thanks for being here.
Thanks, Bob. It's a pleasure.
Hey, before we start talking about your entrepreneurial journey, let's talk about the young man enlisting in the Navy. How did that happen? How did you wind up going into the Navy and then turning around later and becoming an officer in the Army?
Yeah, so I mean, as a 20-year-old, neither of my parents were in the military. Didn't really have much background on that. It was just the first recruiter that I walked into. So ended up enlisted in the Navy. Tried to go into the special warfare programs and ended up going to the fleet, as you do, and spent a few years there as a communications electrician. I knew that I wanted to lead troops, lead soldiers. And so I got out, finished my degree, and I went through OCS and commissioned in the Army.
And there was a period of time between the Navy and the Army. You were out in the civilian world?
Yeah, I got out. I had to finish my degree. So I finished my bachelor's degree and actually started my master's program. And during that time, I was a firefighter, EMT in Georgia. And then I was able to get into OCS and commission, become an infantry officer.
Would you describe yourself as a Mustang then? I guess you are.
That's what they call us, yeah. That's
Yeah.
what they call us.
Okay.
Yeah.
Okay. Now, you have gotten the entrepreneurial bug. This Bobi Health is not your first startup. Am I correct about that?
When I retired from the military, I was a business consultant, and helped a previous startup stand up. There was a Harvard pediatrician, epidemiologist who wanted to start a company to do drug safety studies and the effect of COVID and COVID vaccines on pregnancies. So I helped him stand a company up and took it to successful exit. I was kind of like the chief of staff. And so I saw how it can be done, right? And even, he got a ton of value out of his exit. I did a lot of hard work. I got some value, a lot of lessons learned. Essentially, Bob, through my learning at that company and my personal experience, learned that there's a huge gap in healthcare for women who are pregnant. There's a gap in knowledge. So we were doing the COVID safety studies, or the vaccine safety studies for these drugs that are being deployed out to the entire globe. And to be candid with you, what is being done is inadequate. We don't truly know how safe those drugs are that are being given to women who are pregnant. We're simply registering a couple of hundred individuals to go on and fill some surveys out a few times during their pregnancy to monitor for any adverse events. It's truly, it's antiquated. We have a better way. We have a better technology now, right? We all have, where's mine? We all have them in our pocket, right? There's a whole lot of information we can get off these things. And so that's why I designed Bobi Health, was to do a better way of gathering information about the health of pregnancies and enabling people to make better choices for healthier outcomes.
This is, there's a lot of discussion going on right now around the rush to get all the COVID vaccines out, and the repercussions are still playing themselves out. Probably the discussion for an entirely different podcast episode. But I got Robert F. Kennedy Jr. running around talking about all this stuff. There's an enormous amount of discussion about that particular topic globally taking place.
I can say that we did see that they were safe during the studies that I was part of. It seemed like they were safe, but these studies take years. This is a 5-year-long studies that they have to do to monitor for health. So, I mean, you obviously can't, for ethical reasons, study or give a pregnant woman a test drug to see what happens.
Can't be the guinea pig, right? Who's going to do that, right?
I mean, a regular adult you can, but so it's the best thing we can do. My problem is that it's difficult to recruit and retain those study participants and truly track them, right? What we're doing at BobiHealth, and we actually pivoted, and I can get to that, but we're collecting real-time biometrics throughout the entire life of the pregnancy.
This is a real personal story for you too. I mean, I've heard you share it a couple times in the context of the Founder Institute, but to give everybody background, would you sort of share the personal story of how this kind of started?
Well, I mean, so my wife Sarah, she had a high-risk pregnancy. It was complicated. I can't really complain about it too much. And honestly, back then, like I was still really clueless how wide scale of a problem this is. I mean, it's truly an epidemic. We had great healthcare, military healthcare here in San Antonio. So Cooper and Sarah were taken care of. She was able to get a C-section, and they're both healthy today. It did prepare me for to be able to understand how we can solve for this. It's the problem is every day 800 women die. Every 2 minutes a woman dies from maternal health complications.
Is this how many of these are in the United States versus other parts of the world that are not so well positioned?
Well, obviously, it's more dangerous to have pregnancy in these third world countries. And we're actually working on that. We're working on a partnership with Uganda, and we're going to be speaking to Cameroon soon. We're in India and the Philippines. We are actively trying to make an impact in these countries that don't have the healthcare systems that we have. Yes, our numbers are more in the hundreds of deaths, but we in the U.S. see over 50,000 maternal morbidity cases that are severe that also affect families, right? They can affect women for their entire lives. And the cost of these maternal morbidity and mortality is in the billions, $40 billion a year of costs to the U.S., hospital systems, insurance, bill payers, even employers, right? And costs to these families. Avoidable cost. I mean, that's what I was getting to. 94% of these adverse events are avoidable. So these are avoidable costs that this family doesn't have to have the burden of, or the heartbreak from the loss of a mother or their child. So
I personally, my wife and I have been personally touched by this, where one of her very, very close friends took a baby all the way through full term and lost the child within hours of childbirth.
It's heartbreaking. I hear these stories just, and every day I go and I talk to our customers, it's a deeply personal conversation every time. I mean, it's a human condition. And I often get the question like, oh, you look like a great dude, like, bro, I'd go have a beer with you, but how is it you're leading a women's health and to me, it's not about me it's about being a human. I mean, either you care about your fellow humans or I guess you don't. No.
And it's so take a second to kind of define the problem, and then let's talk about your approach and solution.
I mean, well, the problem is that 94% of maternal mortality is avoidable,
Hmm.
right? And all the associated costs and all the maternal morbidity that happens, that
Is there one or two specific
conditions.
ailments that lead to 80? Is there an
Well,
80/20 rule of what is the one thing that happens most often that leads to that?
hemorrhage is a huge
Right.
problem. So what our app monitors for are conditions like hemorrhage, preeclampsia, eclampsia, infection, and mental health issues. So mental health issues and is also a huge problem in pregnancy and post-pregnancy. So these are conditions that if we can identify them early and get early care, we can severely reduce the severity or even the occurrence. Because we can even, I mean, Bob, with our machine learning models, we're able to now predict live birth with over 90% accuracy.
Is this machine learning that specifically is tailored towards the individual as they're using your technology, or is it broader than that?
Yeah, so it is personalized as a user uses the application. But what we're talking about here is predictive analytics. So it's really statistics on steroids, where you've heard the term big data.
Hmm.
So we're collecting just a tremendous data set, this huge, I mean, all the biometrics, heart rate, breathing, O2, temperature, activity, food, medications, all of the, even all the demographics. So everything we can about the individual and and just putting in this mass data set. And by collecting symptoms and outcomes, right? Symptoms and outcomes, we can eventually predict these adverse events, right? Not just identifying them early, but predicting them.
Okay. And so, you mentioned earlier, you alluded to this, you're walking around with the phone in your pocket, the Apple Watch,
Mm-hmm.
I use it to monitor my sleep, heart rate,
Oh yeah.
exercise, those types of things. Are you integrating into tools like that and picking up specific data that then, tell me how it works.
Yes, absolutely. Yeah. Optimally, the best case scenario is our users have a wearable that monitors those biometrics. That makes it really easy for us and the user. And I mean, these things are ubiquitous now. We're trying to pilot Bobi Health with healthcare systems where if they don't have a wearable, we give them one. It's like $100, like $100 versus a NICU stay, which averages $50,000, right? If you have a preterm birth, right?
Mm-hmm.
Pretty cost effective. Uh, Apple and Android have made this really easy. So we can integrate with any off the shelf wearable. This is why we're not a hardware company, right? It's all already out there.
You guys have
Uh,
recently been awarded a patent for this technology that you've developed. Is that correct?
the patent is for our machine learning ops architecture.
Hmm.
So the problem that we're solving for there is that we have customers that are reluctant to use um, maternal health monitoring applications because they're worried about their data being used. And totally understandable. Like this is a minefield, and um, what we wanted to do was make it impossible for a malicious actor to come into our system and
Hmm.
retrieve user data. And if you're using machine learning models to train, or if you're using personal data to train machine learning models, it's very difficult to truly delete or to truly de-identify the information. So
Right.
a sophisticated actor could come in and retrieve that. And if you're talking about, oh, this 17-year-old is pregnant in this small town and with this, income level and this health
You
level of
need
health,
HIPAA on steroids, so to speak.
yeah, it's pretty easy to identify them. So we created a way that makes it impossible. It's federated machine learning, so will deploy our machine learning models to the device.
Who are the regulators for you? I mean, are you going through? I don't think we've talked about any FDA approval or medical device approval because it's really not doing
Right.
anything other than being a monitor. But is there
Yeah.
some kind of standard that you feel like you guys have got to meet or?
We're not diagnosing, so we're not a medical device, although there's a pathway to get there if we decide to pivot. Um, but we choose to be HIPAA compliant, and we choose to be GDPR, which is the EU standards
Mhm.
for personal data. We choose to adhere to those. Um, Other regulators are the state. So California, this is the strictest for digital
Right.
data protection. So we adhere to the California standards and that make sure that we're meeting any rules in the U.S.
Interesting.
Hmm.
Let's take a step back for a second and talk about the entrepreneurial journey. Uh, what's it been like to go through this process of starting a business? And I wonder if your experience, having been sort of through the crucible of the military, has prepared you for what you've
Yeah.
encountered along this journey.
You know, I think about this all the time. I went my second career after leaving the military was project management. And being an Army officer absolutely prepared me for that. I mean, you're always doing something unique, and it's the basic troop leading procedures, right? Receive the mission, issue the warning order, make a
Yeah,
tentative plan, start
right.
necessary movement. You know, and this is project management, which also prepared me for starting a company. Um, I was able to help the previous startup that I worked for, but because of that, and it's all about effective communications, leadership, understanding, being able to fix complex problems. And can I say a curse word on the show?
Oh, yeah.
Get
Hey,
shit
look,
done, man.
I'm gonna call Joe Rogan and get some
Get shit
pointers.
done, right? You
Yeah,
learn how to get shit done when you're in the military, or hopefully you learn how to get shit done.
right.
Uh, and that's startup 101, right? Like, what's the immediate problem? Fix it, get it done. As a CEO for a brand new startup, you're wearing all hats. So one minute
You
I'm,
got limited resources too.
oh
I
yeah,
mean, it's
and and it's also like building a culture and motivating
well.
team and
Let me
recruiting.
ask you the culture question. I mean, have you given a lot of thought to what kind of people and what kind of ethics and what kind of culture you want to build in the company, and where does that have its roots?
Well, I take this very seriously, right? Defining a mission, defining a vision. What are your values and what is your strategy? And I initially said, all right, here's our mission, here's our vision, and that hasn't moved. The needle hasn't really moved there. So our mission is to make pregnancy safer by providing intelligent monitoring and alerting solutions. Our vision is to end avoidable maternal and infant mortality. Right. My team, once we started bringing on the team, and I had, I think, 12 people at this time on the team, mostly part time, working together every day, building this thing. We had a workshop, and I asked them, what brings you to work every day? Like, what makes you want to show up? Nobody's getting paid. Why do you come here? What are your values? And so we defined what our values are as a team, and we work through, okay, how do we get to this vision? How do we get here? End avoidable maternal infant mortality. And we created the strategies together to do that. um, we continue to go back to that and look, like, are we still aligned? And essentially, to I guess tie a bow on it for our culture, we have one rule, Bob: no assholes.
Okay. Yeah.
That's it.
Wait,
And
you arrived at that rule earlier in your life than I did, but I established it. Absolutely.
yeah, yep.
Let's shift gears just for the last couple of minutes here. You and I have been going through this Founder Institute process. Shout out to those guys, Mike Sherbakoff, Ryan Micheletti,
Right.
and
Great
we're going
guys.
to be getting to see them in a couple of weeks out in San Diego, the big graduation event. I'm looking forward to that.
Hmm.
What let's talk about that journey in a little bit. What surprised you? Was there? I'm sure there were a lot of things you saw that were, oh, well, yeah, I've done that. But what are the things that you think where it's made you stretch and think differently about how you're approaching this project?
So I guess fortunately or unfortunately, I've done these other programs.
This isn't
But
your first rodeo, so to speak.
yeah, well, I guess at this level it was.
Okay.
That's what I was getting to because I've been through pre-accelerators and incubators and different programs. We just finished a really great, which was focused on community health through Velocity, Texas, the Methodist Healthcare Ministries. And the big difference between it, and so at these other programs, they'll have a great SME come up and give a great presentation about go to market or about legal or about your team, whatever it is, the topic of the day. But what Founders Institute did was you get homework. You have to do the work and show your work and send it in and then present it, right? You've got to know it, understand it, be able to speak to it. That's what took me to the next level, right? I got it, and I had, a lot of the stuff I'd already worked on, my business plan, my lean business, model, all these great tools, but I had to go out and find customers and interview them and talk to them about the product
Mhm.
and write about it, right? This was incredibly impactful. That's just one example. Every week, 20 hours doing the work, recording myself talking about it, right?
Right.
That level of accountability is what makes this program that next level. So I
It's
highly
a
recommend it.
it's a little executive MBA and entrepreneurship.
I
It's
When I try to explain it, I say mini MBA. That's what I'm
yeah,
working on right now. Yeah.
it's really good. Well, um, how do people get in touch with you? How do you like for folks to find out about Bobi Health and how can they reach out to you? And of course, we're going to put links to all of this in the show notes, so you don't need to write it all down. But what's the best way to get in touch with Dave and other members of the team?
Yeah, great. You can find our website, bobihealth.com. It's BobiHealth.com. I'm Dave at bobihealth.com is my email address, or you can reach out through our website as well. We're on all the social medias. Bobi Health, Bobi Health AI is out there. But feel free to, if any of your listeners want to reach out, I'm on LinkedIn, Dave Esra.
Yeah, we'll put links to that. What is in the last question, sort of what do you hope to accomplish in the next 6 months? I mean, what's the next big milestone?
We are, oh, we're driving hard to get the Spanish translation out.
Wow.
Um, so that's going to be huge and open up our potential user base and opportunity for impact. We are also building on the Android platform. We launched originally on Apple, which is available now. So those are a couple of key development milestones, and um, within the next 6 months, we plan to launch at least hopefully 2 pilots where we can work with a clinic or with a small healthcare system to prove out uh, the impact or the savings that systems will get from partnering with us and having their patients use Bobi Health.
Well, Dave, thank you. We're coming to the close here. Really love what you're doing. You've got an honorable and worthy mission, and wishing you the
Thanks,
best
Bob.
of luck. You've been listening to the Mission Oriented podcast on the Veteran Crowd Network. We bring veterans and military service members who are doing special things, particularly entrepreneurs like Dave Esra. Dave, thank you for appearing on the program today. I will give you a big Army Bravo Zulu for your performance today.
Cool.
Thanks so much for being on the show.
You bet.
And that's a wrap.
Thank you for listening to Mission Oriented. Make sure to hit the subscribe button and you won't miss an episode. To learn more about Mission Oriented and the Veteran Crowd Network, visit us at www.veterancrowdnetwork.com.